think sort of building on what I just said, I think there are many things we can do for our patients that are very effective. We've just recently, it's actually as part of our sort of equity work and trying to improve access, published a primary care pathway. And we intentionally, based on prior work, where we had found that it was essentially too much to ask our primary care colleagues to be able to use some of our, some of our prescription preventive medications because they weren't familiar with them. So in that primary care pathway, we intentionally suggested that we just use vitamin supplements as first-line preventive. There's a lot of reason to think that that may be helpful. Whether you think about it as placebo, whether you think of it as active, and many of the vitamins are essentially targeting mitochondria and potentially help with energy in the cells. Regardless of the reason why, they're often helpful. There have been a couple of papers describing that still, 2/3 of children will respond to vitamins if that's the first line they're given. So if you think of it from that perspective, right, if 2/3 of people get better from the first thing and maybe another, half or more of those get better from the second thing you do, that's great. Is the second thing essentially then cognitive behavioral therapy? There's a study ongoing actually to look at whether cognitive behavioral therapy alone is equivalent to cognitive behavioral therapy plus amitriptyline. That's building on essentially a study where we did kind of the opposite, where it was cognitive behavioral therapy, amitriptyline plus education versus amitriptyline plus cognitive behavioral therapy. The CBT and amitriptyline were better. Now we're kind of flipping it on its head. That's run by Dr. Powers out of Cincinnati. So is our second line another med? Is our second line CBT? There's a lot of options. So again, when you think about patients as a whole, there's a lot of kids who are going to get much better with the first few things that we might recommend. It's frustrating that we don't know what to recommend, right? I can't, if a child walks into my office, I wish I could say, let's get a swab of your cheek or, fill out this questionnaire and I can predict you're going to respond to this medication. There's a lot of work trying to get to that point, and hopefully 10 years down the line or so, we'll have a better way to target our therapies. But for right now, most people will respond to the first couple of steps that we do. However, for those kids who don't, it's incredibly frustrating, right? Sometimes we're trying 5 or 6 different preventive medications. We're often appealing to insurance companies to give us approval for these more aggressive and newer therapies, often with a huge amount of time investment on the part of the clinical team to try things that we think are more likely to help. And sometimes kids still don't see improvement. And so it's trying to balance caring for the big group, but then also advocating for the kids who are still having trouble.